Assalamu alaikum wa rahmatullahi wa barakatuh. My dear friends and colleagues, peace be upon everyone, whoever watching. And we are thankful to our Lord Almighty that we are able to discuss the common issues our parents and our community facing dealing with youth. So today we are going to discuss a very interesting and deadly we can say deadly question that can cause fatalities among youth. That is, how should parents investigate and counsel children suspected of drug use? I repeat, how should parents investigate and counsel children suspected of drug use? I was going to share very quickly some statistics related to youth drug use in the United States. So this statistics is coming from National Center for Drug Abuse Statistics. And as you can see, drug use among youth, facts and statistics, there is a high percentage, 61% of youth, eighth graders between 2016 and 2020 used some kind of drugs, and 12th grade abused alcohol 62%, and 50% of all teenagers have misused a drug at least once. What is more saddening is the death among 15 to 24-year-olds. As you guys can see, the statistics is rising. Sometimes it's going down depending on overdoses, but for other types of drug use, there are fatalities, and we can see in thousands of numbers. So we would like to go ahead and start the discussion with our expert panels, Dr. Habiba and Dr. Ranginwala, on these topics. And we are going to start with Dr. Habiba first. So Dr. Habiba, please go ahead.
Walaikum assalam. It's a very important topic. As we see in the graph, it is alarming. Even the middle school students are exposed to drugs, and it is going very, very, very high. It is very alarming. And it is a big topic. I will try to touch important points. So as I mentioned before regarding the teenagers' mood, first, we need to have a connection with our children. So sit and talk with the children, sooner the better. You have not started already, but at least sooner the better. You start, spend time with the children, sit and talk with them, how things are going and all. And if you find something not applicable, no punishment, and try to understand the situation and always be forgiving and supporting. And then our religious teaching also will be definitely helpful. So yeah, next slide, please. Next slide, please.
Yeah.
So sit and talk with the children. Start talking about the bad effects and addicting behavior of these tobacco products and other substances. Start around 10 to 11 years, talking with the children from the beginning, right? So, and then around 10 to 11 years, sit and talk with them about, let them know the information about the bad effects and things like that, because in the school, they will be knowing with other friends and all. So we need to know where we stand. So before that, parents need to know the correct information, so they can be transparent and open with the discussion. So, we need to know what are the things. So then that will.
I think we lost Dr. Habiba, and while she's coming back, Dr. Najib, would you like to add something, please?
Yeah, it's a very important topic. So, from my point of view, I can say we really want the parents to be aware of the situation rather than learn the hard way. So from psychiatry point of view, it's very important that when the kid is going towards using drugs and things like that, they're going into the reward phenomena, right? And because they want to get the pleasure out of it, the situation at home or surrounding is not that good enough, and they get pleasure from, and they just incidentally or by experiment or by peer pressure or other influences, they get hooked up into it. Sometimes they are in a good background, but because of the surrounding and all those things, experiment, let's see it, how it feels like, things like that. And then once they hook up, it's a huge change take place. So it's the so the goal comes here is how your parents and the kid attachment is, and how the bonding between the parents or caretaker with the kid is. That is significantly important to have the harmony and understanding and the concept, because if the kid have a very strong bonding attachment, they have a lot of trust. When they have a trust, even in a bad situation, they will get out of it. They find reason not to get involved into it. So the trust is the most important factor, and to that you'd have to have attachment and bonding with your caretaker, which is your parents. So avoid that reward phenomena of using the drugs, because then they will start listening to their parents or caretaker that don't go in that direction, even if being offered or by choice or without any choice or by any other circumstances, they know how to get out of it. Just like we avoid drinking or doing things as adult, they can learn that phenomena too, that even if it's provided, how to stay away from it, because they value their parents and the trust between them. So it's very important for the kids to understand this concept. Second thing which you have to, which has been seen numerously in the last 20, 30 years of all the studies, that exposure of drug before the age of 25 has a significant finding as compared to somebody who get exposed after the age of 25. And this is the critical time period which it has been seen that uh, when the people who are older than 25 exposed to the drugs, their likelihood of getting out is much better than the people who are under 25. And the reason behind that is the maturation of the brain. So you have a myelination process and all those things take places. At early ages, the myelination is not totally done. So you hook up into the reward phenomena, and now you are on a different pathway of learning systems. So after age of 25, when the whole myelination of the brain has taken place, most of the myelination has taken place, your thinking power is at a better level of thinking. So you can get out of it much easier if the first exposure happens after 25. It does not mean that you should do it. At any age, it should not be done. But if somebody wants to, that is what they're showing up, that after age of 25, people can get out of better than the people who are under 25. And that was the reason. So this is some of the features coming up. The other thing which is coming up is a fentanyl overdose, which has been a significant cause of death among people, because it has been produced at home, other places, and easily overdose because they enjoy using drugs and things like that, not realizing somebody has mixed fentanyl with other drugs, not knowing that. So that is very scary. It's very difficult because uh, just a minute. It's very scary that where people are mixing fentanyl with other drugs and they don't know what is being mixed. In the ER setting, they come and a lot of people are pronounced dead because they didn't know what was put into the drugs, including fentanyl overdose has been significantly been seen in the ER setting. So it's very important to know that staying away from drug is extremely important. Dr. Habib, you can join in. Sorry, since you were not there, so I joined in and go from there.
You can finish it. I don't know, there is like some problem with my computer or whatever. So, you know, these extra things we can cut it down. So you please finish. I will tell.
Okay. So yes, so in the ER setting, we have seen a lot of fentanyl overdose, and majority of the people or some of them didn't know about that somebody has mixed fentanyl to hook them up, and they get euphorias and all those things, and not knowing that respiratory depression take place, and they didn't realize it, and they don't get help because they're afraid that they're using drugs, so somebody will consequence will come, so they don't get help, you know. So staying away from the drug is the ideal way of dealing with it. Even other thing which is also important, which become more deadly, is alcohol. Drug and alcohol are two things which you stay away from it, because each of it helps other. So somebody is using drug and then drink alcohol, make it a deadly combination, because your response is slower with alcohol. And then when you're taking drugs, that has enhances the response of what they do. So I strongly recommend never to use drugs. It's although available, but you should stay away from it as much as possible. There are other things are available on the street in the name of they are less um, potent, they say, or less they say in a different, in a nicer version, like legalizing marijuana, things like that. There's a lot of issue has the recent studies in the last 10 or 20 years are showing marijuana has a significant effect for mental health. People use marijuana for end of stage life phenomena, but for a normal person to take marijuana or marijuana-like product is not recommended. So that is my suggestion, to stay away from marijuana-like substance, because even if it's a lower level, it does affects your system, it affects your genes, and we don't know which genes we carry, which can get activated. And when it get activated, you can have a psych component can come also. So we don't know about that, which genes can get activated and produces psych components. And you may have developed a lot of other phenomena of anxiety, depression, and even psychosis can happen with different type of drugs. So it's very important to stay as much away from drug as possible, especially when you're young. That is also very important. Dr. Habiba, you can go ahead and complete your presentation too.
Thank you. Thank you. So, you know, first and foremost, sit and talk with the children, start talking about the bad effects and addiction behavior of tobacco products and other substances like marijuana and all other street drugs and all. Regarding this, you know, sitting and talking with the children, it needs to be like from the beginning. And I will say, if you have not started, you please start today. And then regarding these drugs, tobacco, alcohol, these kind of stuff, you need to start talking to them around 10 to 11 years of age. You know, what is the bad effects and all those things. And so for that, parents need to know the correct information, so they are transparent and open with the children. So there are some YouTube videos I shown here.
Yeah, I think we lost her again. So we'll have the links available for our audience, so they can, watch these videos later on. And then I think there you go. Dr. Habiba, back again.
Then the next slide, please.
Yeah, sure.
So then the parents need to engage in the child's school activities, school to support student health and learning. So how to do it? Take advantage of the support school provides for the parents. So know about, you know, what all the support the school is having. So take time to volunteer, communicate with the school, and read the information it provides to you. Then ask your child to share with you the health and safety behavior learned in the school. So, some parents, they don't have time to volunteer in the school. I will recommend as much as possible, connect with the school, what all the resources available in the school for the parents. And if you can't volunteer, at least, read the information the school is sending, and then, be like, know what's happening. And also, ask the children every day, okay, what happened in the school? What did you learn today? All those things. So that way, you know what's happening in the school. Next slide. Next slide, please.
Yeah, right here.
So it has been like research shows that students studies have shown that students who have parents engaged in their school lives are more likely to have a higher grade and test scores, better student behavior, and enhanced social skills. Also, in addition, students who have parents engaged in their school lives are less likely to smoke cigarettes, drink alcohol, become pregnant, be physically inactive, those kind of things. Studies have shown. So I will recommend the parents to involve in the school activities, and also at least to know what's happening, or like sit and talk with the children, what's happening in the school, and get to know about what's happening in the school. Next slide, please.
Sure.
So then, how to spot sheath and disposable e-cigarettes. So youth may be using sheath e-cigarette products disguised as backpacks, smartwatches, sweatshirts, then fidget spinners and gaming devices. Be on the lookout for disposable e-cigarettes, which have become more popular among youth. So, and the next slide, please. So do you know, so this sweatshirt and the backpack has a sheath pocket for e-cigarette system to deliver aerosol discreetly through a hose that's woven through the fabric. These products make it easier for the teens to vape without raising the attention of adults. Then next slide, please. Look at these products. See, can you immediately tell which product is the e-cigarette? So they are making the product similar to, the smartwatch, and then other like the gaming device and things like that. So the parents need to be aware of it. And also parents you go into their room, and then let the children know that you have access to their room, their things and everything. So please, next slide, please. Some common disposable e-cigarettes, they resemble like a USB flash drives, and they also appear in bright colors. So I will tell you some example. It's so very common. And these e-cigarettes, in that they put other stuff too, marijuana and other stuff too. So it is very, very, very bad. And then, it immediately affect, the lungs, and, and cause death if not taken seriously. There are like many teenagers, good children, they behave like differently. They had chest pain, palpitation, and then they went to the ER. The parents called 911 and took them to the ER. Then they did all drug screen, everything, and they found the marijuana and the e-cigarette products in their system. And then they agreed, yes, they did, and those kind of things. So the first, prevention is better than cure. So first and foremost, be frank with the children, sit and talk with them, and then what's happening in their surroundings. And also religion, religion also plays a very important role. So, include, what is important. So, religious teaching. There are like alcohol and other like marijuana are haram, but smoking is not haram. So children may thinking, oh, okay, this is not haram, but you need to know in that vaping product, they include marijuana and other stuff, and it's available. It's even available to the middle school children. So please, remember all that. You need to know the information, what are available and things like that. And then also, there are I share those videos. So you please, watch those videos. You can watch alone, and then if it is like you can watch with the children, means you sit down and watch with them, let them know the bad effects. They really do not know. No one wants to like hurt themselves. No one, children also, they don't want to hurt themselves. They fall into prey thinking, it is not going to be, they are not going to be addictive. And then one-time use is not going to be bad. And also they feel good. There are like some children, in my clinic, they tell they feel good. That's why they use marijuana. So for marijuana, there is only one role, only for like people who are like dying before death, for them, just, as a medicine to keep them calm and comfortable. So that is the only place for marijuana. There is no place. So religious teaching also will come very handy, and tell them, be faithful, be truthful, and then Allah is watching them all the time. And then they can hide from parents, they can hide from teachers, but not from Allah. So they need to be like, know that Allah is watching, and then they need to do the right things, what they learn. So thank you for the opportunity.